Hepatitis B. For hepatitis B, you don't have an option. All students must provide proof of blood test report for hepatitis B to determine immunity. So please ask your doctor to give you requisition to do blood work for hepatitis B. A week after they've taken your blood, please book an appointment with your doctor and ask them for the copy of your blood test report. Once again, if it shows reactive to hepatitis B, that means you're immune, that means you're fine, that means you don't need to get additional booster shots. If you're non-reactive to hepatitis B, you are required to get and pay for the Hep B booster shots. When your blood test comes back non-immune, please don't worry that you have to get 6 doses by the given submission deadline. We will ask you how many doses you had in the past. According to Canadian Immunization Guide, we only required 6 doses in a lifetime. If you're not immune to hepatitis B, we will ask you if you had previous doses during your childhood or in the past. If you do, please check your old immunization record, such as your yellow card or any proof of immunization record from your regional public health, and see if you have any doses in the past. If you do, please ask the doctor to transfer the dates of your old Hep B shots on the form. As you can see here, this student was able to find their 2003, 2004 doses, and if that's the case, please ask the doctor to transfer the date on the form and start at the brand new dose. And this reduces the number of doses you are required in a lifetime. If you can't find any record, then you have to start at the first dose. The main thing is you receive the first dose and second dose by the given submission deadline of your form. Even if you've done the blood test in the past, whether it was 10 years ago, we will still accept your old blood test report. But please make sure that your doctor give you a copy of the blood test report and attach it to your health form documents.